Our guest on This is America and the World is the president-elect of the American Psychiatric Association, Dr. Vivian Pender. Dr. Pender is clinical professor of psychiatry at the Weill Cornell Medical College and training and supervising psychoanalyst at Columbia University.
You know, the American Psychiatric Association has almost 39,000 members, and they're mostly in the US, but we also have members in 100 different countries. And the mission of the American Psychiatric Association is to ensure humane care and effective treatment of persons with mental illness, including substance use disorders. Mm-hmm. So it's the oldest medical professional organization in the country, and it's the voice of modern psychiatry. So I say that as I will next May become president, and I understand my role as a steward of that mission of the APA. And
you used the phrase substance abuse disorder. I gather that's a term that now refers to what was in the past called addiction, huh?
Yes. We actually have dropped the term substance abuse because it seemed so pejorative, and we say substance use disorder.
Substance use disorder, huh?
Yeah.
What caused that? Why is that happening, or why has it happened?
I think that over many years, it was very misunderstood. Substance use disorders were very, very misunderstood, and people thought, that someone who did become dependent on a substance, alcohol or drugs, was weak, or had a weak character, and if they were just strong enough, they would be able to overcome this. And that's not what we think now at all. We recognize that it's an illness, like other illnesses, like diabetes or hypertension. Unfortunately, unlike diabetes and hypertension, we don't have a great treatment yet, but we're on the path to developing. We have some really good medications now, so it doesn't have to be that a life or many lives are destroyed by this illness. And I'm very optimistic that as we go from blaming people for having this difficulty to helping them with their difficulty, that things will improve for everyone.
So this is a critical part of our conversation, because you're taking substance use and you're putting it under the heading of an illness, very much, as you say, like diabetes, or it could be heart disease or something like that. Is that, I'm a recovering alcoholic myself, so I'm wondering if the new terminology, the new phraseology, if that is a tough sell, or is it making progress so someone does not look at somebody's behavior and call them weak, or if you just stop drinking, everything would be fine, or if you just stop using drugs, everything would be fine. Has that been a tough sell, or is that making progress, that it is an illness? And I agree with you, of course.
Yeah. I mean, you must know very personally how difficult, or sometimes impossible it is to deal with that kind of illness by yourself. So I think that it is a tough sell, because somehow alcohol got involved in religions and commercial enterprises, that it is difficult to make that very clear. But I think we're well on our way.
Let me take a little break, Doctor. On the other side, I want to talk a little bit about the difference between a psychiatrist and a psychologist, and how you chose psychiatry yourself. We'll pursue that on the other side. Sit tight. This is America and the World. Underwriting for This is America and the World is made possible by the National Association for Children of Addiction, Faces and Voices of Recovery, the Forerunner Foundation, the Rotondaro Family Trust, the Sultanate of Oman, the Kingdom of Morocco, and the Embassy Series, Uniting People Through Musical Diplomacy. Let me ask a very simple question, but confusing to some folks, the difference between a psychiatrist and a psychologist.
So a psychiatrist is a person who's been to medical school and is therefore able to look at the whole body and also prescribe medications. I think that's the most important thing. As we know, there are 100 different possible medical reasons why someone might be having a psychiatric symptom. So it's very important to get that kind of medical holistic approach to a person. Psychologists in general do not prescribe medications, and they do not go to medical school, of course.
So looking back on some of our previous conversation, when you're saying that we have illnesses that are under the heading of mental illness, this MD training, this medical training, seems to be critically important in making some evaluations, if it's genetic, if there's some kind of trauma involved. How about yourself? What caused you in your medical training to seek out psychiatry as something that you wanted to kind of major in or choose as a career path?
Something that I wanted to spend the rest of my life doing.
Yeah.
Yes.
Yeah.
Well, I think that many of us in psychiatry have either faced some difficulty ourselves or someone in our family did. And especially if it's someone in our families, we wanted to help that person and we wanted to learn how to do it. So speaking for myself, I actually started training after medical school, started training in internal medicine. I thought I would become an internist. However, at that time, there were many people whom we could not cure, and some people who were dying because we couldn't save them. But what I could do is talk to them. I could talk to them and their families, and I could at least help them to feel better and to deal with what was happening to them. So I felt actually that, or I thought that I could do more in psychiatry than I could in internal medicine. And so I became a psychiatrist and never looked back, and have a passion for it. And I've had a wonderful career.
The idea of a psychiatrist being able to prescribe medication, I gather that the acceptance of medication in treatment now, coupled with what we would call talk therapy, is very accepted nowadays, and quite often a therapist might even start by prescribing some medication to help stabilize the client and get them involved in the talk therapy, as they call it, huh?
Yes, yes. So in my experience, my clinical experience, I think that psychotherapy has been the most beneficial for my patients. There are patients who can't engage in psychotherapy because they're too anxious, they're too depressed, or they're too removed from reality. You know, they're psychotic. And so that has to be treated with medication first. But the ideal treatment is medication and psychotherapy combined. The studies have proven that.
So the combination of both. I can remember some years ago going through a bad patch and being prescribed some kind of medication. And the only way I've ever been able to describe it to someone is, it's not as if a negative thought didn't come into my mind, but it was almost like the negative thought was on a very fine wire. And what happened was the thought came into the wire, but the medication helped clip the continuous wallowing in the negative thought. I guess we would call it self-pity. And that's the only way I've ever been able to describe it. It wasn't that the thought didn't come into my mind. It was just, it cut the wire. So medication has a huge role, huh? And I gather that psychologists and therapists are often working in tandem nowadays with psychiatrists for the very prescription of the medication.
Yes, there are a lot of those what we call split treatments. I don't do that myself, but I know a lot of people do. But I would say about that, you know, that thin line that that was kind of snipped. I also describe it as something that's just kind of pushed to the side.
Yeah.
The volume is turned down.
Yeah.
It's just not as loud anymore. So it's manageable.
So that would be, and I like your idea of pushing it to the side or turning down the volume as opposed to my cutting the wire. The same thing in a way, but a gentler way of approaching it. And now I understand very clearly that if a person is going through a very bad patch, be it anxiety or depression, the talk therapy really can't work until that is stabilized. That's what I hear you saying. Am I correct?
Yes, absolutely, absolutely. And then, you know, another big part of the therapy that I engage in with my patients is that, especially if they had something as a child, let's say they had attention deficit disorder, but nobody knew. So they got failing grades. They could never concentrate long enough to read a book. They were impulsive, sometimes destructive. And what they were told is that they're selfish, they're evil, you know, they're bad children. And then they come to see me as an adult with all of this self-blame, you know, like it's their fault that they caused their parents so much stress, and they blame themselves. There's a lot of guilt, and it takes years sometimes of therapy to kind of undo that, those self-incriminating feelings that it really wasn't their fault, not at all.
There was a point in what you were just saying where all of a sudden I shifted my head and I was processing when you had said the attention deficit disorder, of the fact that at some point I skipped a grade when I was in elementary school, and they said it was because I was looking out the window and I was bored, and then all of a sudden you said attention deficit disorder. So they skipped me from the 3rd grade to the 5th grade. And the first test I ever got in mathematics in the 5th grade, I got a 10 out of a possible 100. But I felt I was in a therapy session with you. Let us talk, let's talk a little bit about mental health, huh? Self-care at this time, mental health. Give us a definition of good, sound mental health.
Well, in general, mental health is a feeling of well-being, that person is able to do what they want to do, and they feel well. It's really important, though, to recognize the cultural differences in their definition of mental health. So, for example, this morning I was listening to a lecture on mental health in Native Americans, and it's really interesting to hear their perspective. There's a kind of historical trauma that they have inherited, a kind of intergenerational transmission of trauma, something like that has happened with slavery in our country, African Americans, and so my point is that you have to know the culture of the person you're treating, and because there are some in some cultures, like they said in the Native American community, they say our culture is our treatment. So it's not quite so individual. So they feel like if they look to a lot of cultural rituals and practices and the well-being of the community, that helps them individually. It's different. It's different from, the Upper East Side of New York City, where you come to the office and the individual is treated as an individual, separate from the community. There's now a lot of integrated care where a psychiatrist will be part of a medical practice, so that the psychiatrist isn't so isolated or taken away from the rest of medicine. And just like being part of an integrated medical community or clinic, there are a lot of us who go into the community to treat people.
Mm-hmm. When we talk about self-care, and this refers a little bit back to the conversation we had earlier, which was on a previous program, we're talking about nowadays getting sleep and eating well and getting exercise and reaching out to other people. I want to dial in on the reaching out to other people, because a lot of folks are going through life right now, and they're kind of confined to their family and the kids, and people are getting on each other's nerves quite a bit. How can we maybe create a winter pod, or maybe enlarge that circle a little bit with other people who are as safety conscious as you are?
Yeah, I think it's very important to have connections. So for people who live alone, and let's say they're older, I think it's critical for them to reach out, or for somebody to reach out to them. There are some studies that are showing that isolated elderly people may not get ill from COVID, but they may get sick and even their life expectancy may decrease because of the isolation. So it's the isolation that's going to get to them. So I think it's very important to stay connected, if you can, to whomever you can stay connected to. Then we have the other situation where adolescents are home with their college students. They're home with their families, and things that they had expected to do. So, for example, coming out to your parents. I've spoken to some adolescents and young adults who had been planning to come out to their parents, that they weren't cisgender, and they can't do that now because they're in a tight space together. So there are things that are happening now that are being exposed in a way, or have to be dealt with differently. There's also an increase in domestic violence. So people who had previously considered leaving their partner can't do that now for economic reasons also. And there have been increases in domestic violence and child abuse. And there are a lot of hotlines that are very, very busy. There are many more hotlines now. Suicide hotlines are receiving a lot of calls.
So we're in a tough time right now. There are opportunities to solidify relationships with people who we're close to. Opportunities as well to maybe develop a new interest or a new hobby that would be probably taking advantage of the time, so to speak. We're coming to the end of our time, and I want to put one question on the table to you, and that is, if you have something in your bag of tricks, so to speak, and I say that in a positive way, is there something we could do today that would make us feel better? Is there kind of, do this today and you will feel better? What would that be, Doctor?
Well, I think there are a lot of things that you can do. I wouldn't just do one thing. I would definitely connect with other people, family, friends, co-workers, as much as possible. Connection is so important to human beings. The other thing is, in this era, a lot of the structure and rules have been taken away, and so this is the time to be creative. To be creative, you can't be restricted by too much structure, and so a lot of that is loosened up now. So this is the time to do something that you didn't think you could do, and be creative. I think out of a crisis like this, people will become more progressive, enlightened. They're learning more, and I think there's going at the other end of this that there will be some great advances, especially in technology. Even the use of telemedicine, telepsychiatry, and other technology. There are so many apps now that you can use on your phone for meditation, for sleep, for self-diagnosis. There's so much available now. So I think there's a lot that people can take advantage of if they just look for it, and to take care of themselves and others.
Thank you so much, Doctor. This has been a tremendous two conversations, as a matter of fact, that we've had over the course of 2 programs, and it's just been an honor to talk with you. And thank you for the wonderful ideas that you put forth right at the end of our conversation about things that we can do that will make us feel better. So, Doctor, thank you so much.
It's been my pleasure and honor to be here. Thank you so much.
You've helped a lot of people. Thank you, Doctor.
I hope so.
If you are in crisis or know someone who is, these resources offer immediate help. For information about This Is America and the World, visit our website, thisisamerica.net, or our YouTube channel, This Is America TV, and follow us on Facebook and Twitter. Underwriting for This Is America and the World is made possible by the National Association for Children of Addiction, Faces and Voices of Recovery, the Forerunner Foundation, the Rotondaro Family Trust, the Sultanate of Oman, the Kingdom of Morocco, and the Embassy Series, Uniting People Through Musical Diplomacy.